Yeah, it's hard to look back at that incident, and then the images of violence last week were disturbing for most South Africans to watch. What about children who saw images of the looting, arson attacks, and even the aftermaths of murders? And how do you help children to understand? To discuss, we're joined by Dr. Shaheda Omar, who is a clinical director at the Teddy Bear Clinic. Doctor, thank you for being with us. It makes me think it starts with the media. It's really important for us to show people what's going on. But you reminded me that we have to be very careful to follow our own guidelines. We don't zoom in on dead bodies. We're sensitive when people have died or are in pain. And we try and protect people's dignity. And I guess it's good to remember that children are sometimes watching.
Indeed, I think this is the time that we need to be more cautious than ever before, where we actually need to create a holding, safe space for our children and ensure that they are, restricted from viewing such sensitive images, because children are visual, and often it leaves an imprint on their memory and it results in a lot of confusion, and which then creates trauma, and children are not always in a position to articulate or express what they are feeling or experiencing. And what we are already seeing on the ground, where parents are contacting us, where 4-year-olds are refusing to go into the bathroom, or afraid of the dark, or afraid of actually leaving the space where their parents are. And we are finding that older children, where parents are actually concerned about their acting out disorderly behavior that was not present before, is now manifesting itself, where there's aggressive outbursts and all other kinds of uncontrollable behavior, which is of grave concern because of what children are being surrounded by. And I think that is something that we need to be aware of and vigilant of at all times.
Okay, so be careful about what you watch on television when your children are there. What do you do when the children have seen images, or they know something is wrong and they start asking questions?
So very important. I think we cannot pretend, we cannot wish it away, we cannot deny the current reality. And I think it's important to actually process what children are feeling, where are they feeling it, in what part of their body, what are they feeling. And sometimes children cannot actually express those emotions, so use other methods or techniques where they can draw or they can sing or a game. But we need to create a platform where children can talk to this and to say it's okay to be afraid, that it's okay not to be okay. That is something that is important at all times for parents to say, that they are also concerned, they are also experiencing a number of emotions. So to create a platform of permission to engage in dialogue with the child, and to say to the child that if there is anything that's worrying, so there needs to be continuous communication and dialogue with children. I think it's managing those emotions that are critical. Of course, not giving too much information to a child, but trying to be frank, honest, and candid without adding additional information that would further confuse a child and traumatize a child.
Okay, so don't pretend nothing is happening. One of the hardest things for me was to see the family of a 15-year-old girl who took part in looting, or somehow she was there in Meadowlands in Soweto, and was trampled to death. I mean, this is something we didn't even think about, but should parents now be warning kids about the dangers of getting involved in any sort of mob looting? Just be careful where you go, who you follow. I mean, that was a terrible, terrible incident.
So, Francis, you raised something very sad but very critical. I think it's important that parents talk about risky behaviors and protective behaviors, and alerting children to unsafe and safe mechanisms to ensure that they do not suffer further violation or victimization in such a chaotic situation where children's lives are compromised. So I think it's important for parents to have these kind of discussions and engaging with children, not just a once-off, but it's got to be done daily, consistently, and at family time, whether it's eating time or playing time or prayer time. Those are the times which would be ideal for children to reiterate, emphasize safety and ensuring that children understand, because I think reflecting on what they've said and then checking in if the children have understood what they've expressed, and use opportune moments where there's printed media, news media, any opportunity around discussing this is essential.
All right, thank you very much, Dr. Shaheda Omar, who's Clinical Director at the Teddy Bear Clinic.